Okay, so you're dealing with some serious back pain, right? And surgery. Well, it might be on the table.
It's a big decision, no doubt.
Huge. And nobody wants to be in that position.
Absolutely not.
But if you find yourself there, you really want to make sure you're going to the right person. It's not like ordering takeout.
This is your spine we're talking about. It's got to be right.
Exactly. So to help us navigate this whole thing, we're diving into Dr. Katsevman's guide on finding the right surgeon.
And what I appreciate about his approach is it's really about empowering the patient.
Mm.
Like he arms you with these questions you might not even think to ask.
He cuts right to the chase, too. Like right off the bat, he talks about this fellowship-trained designation. What's the magic behind those two words?
It's kind of like, well, think about it this way. You wouldn't want just any doctor performing brain surgery.
Right, you want a specialist.
Exactly. So fellowship training means they went beyond the basic medical degree. They chose to specialize even further, and in this case, it's all about the spine.
So it's like proof they didn't just graduate yesterday.
Exactly. It's that extra layer of, okay, this person really knows their stuff.
But then Dr. K throws us a curveball saying, hold on, a big shot institution doesn't always mean you're getting the best surgeon.
It's so true, and that's reassuring to hear, actually.
It is.
Because we tend to think, oh, fancy hospital, top-notch everything. But Dr. Katsevman points out that some of those big names are more focused on research than practical hands-on experience.
Yeah, it's like the difference between reading about cooking and actually, running a restaurant.
100%. You might actually end up getting more face time and personalized care from a skilled surgeon at a smaller place where they're doing more surgeries, more of the hands-on work.
I never thought about it that way, but it makes so much sense. And he even gets into how this plays out with neurosurgeons versus orthopedic surgeons, which I thought was fascinating.
Yeah, he does. Because most people, they hear spine, they think orthopedic surgeon, right?
Right, automatically.
But neurosurgeons actually often end up doing a higher volume of spine cases during their training, even though it's not always what they're known for.
That's so
It
interesting.
really is. So it goes back to that idea of not judging a book by its cover. Look at the actual experience, not just the title or the hospital.
It's like sometimes the generic brand is just as good, if not better. And when it comes to our bodies, effective is the name of the game.
Absolutely. And that's what I love about Dr. Katzman's approach. He's all about empowering you to dig deeper, to look beyond the surface level, and become a more informed healthcare consumer.
It's so important. So moving from those credentials to the surgery itself, Dr. Katzevman is clearly a huge proponent of minimally invasive techniques.
Oh, absolutely.
And we're not just talking about smaller scars here.
No, not at all. This is about a whole different philosophy when it comes to surgery.
Mm.
Minimally invasive spine surgery is all about minimizing the trauma to your body.
Which makes sense. Less trauma, faster recovery.
Exactly. Faster recovery, lower risk of infection, shorter hospital stays. I mean, who wouldn't want that?
Sign me up. He even gives us a list: robotics, navigation, neuromonitoring. It's like a shopping list for your spine surgery.
I love that you put it that way because it highlights his point.
Yeah.
You have options. One surgeon might be all about the latest robotic system, while another might focus on their hone skills with less tech.
So it's not about being wowed by the fanciest gadget.
Exactly. It's about what's the best fit for your case.
And that's where I imagine open communication with your surgeon becomes so crucial.
100%. It's not just about the technical stuff. It's about the human element, that doctor-patient relationship. And honestly, that's where things can get tricky sometimes.
We've all been there. You're in that exam room, the clock is ticking, you're trying to explain what you're feeling, and it's like,
You feel rushed.
yes, rush, totally.
Yeah.
Like you're on an assembly line.
It's the worst. And then they hit you with the medical jargon, and it just feels impossible to get your questions answered.
The worst. And this is where Dr. K's advice really resonates. He's like, hey, feeling heard by your surgeon, that's not a bonus, that's a must-have.
It's huge EE. And it goes back to this idea of being an empowered patient. If you're going to make a major decision about your health,
Which this is...
absolutely, a major decision, you need a surgeon who actually listens, takes the time to explain things clearly, and respects your concerns.
And he doesn't stop there. He even points out that it's not just about the surgeon, it's the whole team. Like, if the office staff is a nightmare, is that really where you want to be putting your spine's fate?
It's so true. I mean, think about it. You're going to be interacting with these people potentially for months, depending on your recovery.
Through all the good, the bad, the ugly.
Exactly.
Oh.
So having that supportive, organized, friendly environment can make a huge difference in your overall experience.
Okay, so we've got the credentials, the approach to surgery, the communication vibe, and then Dr. Katsevman hits us with this curveball about location, location, location. And sure, he's a little biased towards sunny Naples, Florida, where he practices.
Of course. Who wouldn't be?
Right. But he has a point. It's not just about the beach views, though. Those don't hurt.
Not at all. But he brings up the practical side of things. Traveling for appointments, especially those early follow-ups when you might be recovering.
Still healing, maybe not feeling great.
Exactly. Being closer to your surgeon and their team just makes logistics so much smoother.
Less stress, for sure. And speaking of stress, can we talk about the elephant in the room? Insurance. Ugh, it can be such a headache.
The bane of everyone's existence,
Yeah.
right? Patients and doctors alike.
For real.
Dr. Katsevman gets it. He acknowledges that it's a huge pain point for everyone involved. And his advice, be upfront. Have those sometimes uncomfortable conversations about coverage early on before you get too far down the road.
Honesty is the best policy, even when it's about something as awkward as money.
100%. Okay, so we've covered a lot. We've talked fancy degrees, bedside manner, insurance headaches. And then Dr. Katzman wraps up with this deceptively simple question. Do you like your surgeon?
I love that he goes there.
Brilliant. Because it's so easy to get caught up in the technical stuff, the
Yeah.
credentials, the technology, all of that.
Points.
But at the end of the day, surgery is a very human experience. You're trusting this person with your body, with your well-being.
It's a big deal, and it's okay to factor in that gut feeling.
It's more than, okay, it's essential. If something feels off, if
Yeah.
you don't feel that connection, that trust, it's always a good idea to get a second opinion.
It's like he's giving us this whole toolkit, right?
Yeah.
To navigate not just finding a spine surgeon, but like the entire healthcare system.
It's true. It's like so much of what he's talking about, it applies to finding any doctor, really.
Totally. Whether you need a new primary care doc or you're facing, like you said, something as major as spine surgery. Clear communication, feeling heard, all of that. It matters.
It's about remembering you have a voice in all of this.
You're not just like along for the ride.
Exactly. You're not passive. You have choices, you have a right to ask questions, and you deserve to be a part of those decisions.
To feel empowered. So, as we wrap up our deep dive into Dr. Katzevman's advice, what's the one thing you want our listeners to walk away with? That golden nugget of wisdom.
That's a tough one. There's so much good stuff in there. But if I had to pick just one, it's this whole idea of you being the CEO of your own health.
Oh, we like that.
You wouldn't make a major business decision without, like, doing your research.
A lot of diligence.
Exactly. So why would you treat your health any differently? Be curious, ask those questions, and don't be afraid to really advocate for what you need.
It's your body, your health, your decision. It's about taking that ownership.
Absolutely.
Well said. And on that note, to everyone listening, thank you for joining us for this deep dive. Remember, you've got this.
You do.